Does the union budget reflect the healthcare dimensions of the country? And what are the implications for public and private health systems and the broader health financing and delivery issues in India? To talk on this, we have with us today Dr. Harsh Mahajan, member FICCI, Health Sector and founder and chairman, Mahajan Imaging and Labs. Thank you, Mr. Mahajan, for joining us
Thank you.
today. Let me dive straight in. You have India's public health spending as a percentage of GDP, which is much below global norms and even many of the BRIC countries. Uh, in that sense, from what you've heard and seen till now, from the allocation and the policy signals in the budget, how do you think this budget does in terms of prioritizing healthcare for India?
While we don't know the exact outlay, but I do believe it has increased by about 10% when compared to the last year. It may still be below the 5% which most BRICS countries spend, but then probably the government has to look at the overall scenario and give. But if we talk specifically about healthcare and the focus of the Honorable Finance Minister in this budget, I would say a lot was spoken about healthcare, about the quality improvement, about training of healthcare professionals, about focus on non-communicable diseases, cancer, even trauma, and medical value travel, Ayush, all of these. So overall, I think the budget at multiple stages did focus on healthcare. And over the years, this has been a priority of this government. And once we talk of universal health coverage, then you have to ultimately provide it.
In your view, then, what are the noteworthy positives in this budget? And what are the key areas that you think has been overlooked or maybe underfunded? It can be in the primary, tertiary care as well.
Well, this, I would say, has been a budget which is built on the good work of the past. It is a budget of continuity. And the first thing that the Honorable Finance Minister talked about was biopharma. And biopharma Shakti, as she called it,
Right.
as one of the pledges, Kartavya, for which 10,000 crores has been set aside for the next 5 years. Institutional support to establishment of 3 new National Institutes of Pharmaceutical Education and Research, and the upgrading of 7 existing ones. Biopharma has been something which India is very good on, making biosimilars. Even, companies are trying drug discovery, and this will give a fillip to that, especially clinical research, where she talks about creation of a network consisting of 1,000 accredited clinical trial sites across India to bolster R&D. Then you manufacture something or discover something, there has to be regulatory oversight. And she talks of regulatory strengthening, enhancement of the Central Drug Standard Control Organization, or the CDSCO, to meet global standards, so that once accredited here, they are accepted across the world, and one doesn't need to go in for accreditation again in a foreign country. And also the focus on, like I said, NCDs, cancer, diabetes, by making advanced biological drugs at lower cost, which would be able to target our own population and also be a supplier of this drug to the rest of the world. The next key feature, I think, of this budget as far as healthcare is concerned was strengthening of allied health workforce,
Right.
where existing institutions will be upgraded, new institutions for allied health professionals will be established both across the private and the government sector. And training would be provided in 10 disciplines. These are the technicians that we have in hospitals and diagnostic centers, which would include optometry, radiology, anesthesia, OT technology, applied psychology, behavioral health. So covering quite a large part of what is necessary. And 1 lakh additional allied healthcare professionals would be added to the workforce. So that's really a big target. And we must remember that healthcare is also one of the largest job creators.
Right.
And if we have to take healthcare, quality healthcare, to tier 3, tier 4, tier 5 in rural areas, we need professionals who will be able to go to the periphery and be able to provide it. So this is a step in the right direction. Then again, in the same vein, she talked about geriatric health. We already have a large number of the elderly.
People aging.
And, another 15, 20 years, the numbers will become massive. So she's preparing the country for that, and to create a comprehensive geriatric and allied healthcare system where these people would be trained not only as caregivers, but also be able to provide, yoga and other such activities. They should be trained so that it can be done comprehensively. Focus again on Ayush and traditional medicine, one of the strengths of our country, and 3 new All India Institutes of Ayurveda are to be set up.
Right.
And Ayush pharmacies and drug testing labs will be upgraded to improve certification and quality standards. All of us are very, not very comfortable
Yes, not very
when
sure.
it comes to accepting quality.
Right.
And if these are labs which are set up which certify the quality of these traditional medicines, that would go a long way in creating confidence. Also, we have the WHO Global Traditional Medicine Center, which will be strengthened to promote evidence-based research, something which is very necessary.
Yeah.
Training and awareness in traditional medicine, be it the drug therapy, be it yoga, be it any other form. And the trend and the demand for these medicines is growing across the world. And if they are accredited and of high quality, then they can be a huge revenue earner for that, for us. And then talking about revenue earning, is she again focused on medical value travel. That's something which FICCI has been working on with EY over the last year, and setting up, which will set up 5 new regional medical hubs in partnership with the private sector. This is a white paper we've presented to Niti Aayog, and I'm glad these are being set up. These hubs will function as integrated healthcare complexes combining medical services, that is allopathic, surgery, whatever may be necessary, education and research, and would be holistic in nature. That's the target, where there's diagnostics, post-care, rehab, Ayush centers, and medical
combined.
tourism facilitation centers. Probably the External Affairs Ministry would also have a role to play in facilitating easy visas for medical value travel, something which is the ultimate objective being to position India as maybe the best hub for medical value travels if we are able to combine everything together, our massages, the traditional massages, with Ayush, with the best that allopathy has to offer. And so all in all, I think very, very focused on healthcare. And finally, she has set aside 10,000 crores for the SME sector as a whole.
Right.
And I think our small hospitals, our diagnostic centers, engineers who set up companies for manufacturing of medical devices, medical equipment, lab equipment. They could make use of these funds which are set aside for the SME sector. So even though we may not be anywhere close to the 5% that the others spend. In fact, there are countries which spend 18% of their GDP on healthcare. But, focus on these specific areas, and the fact that the Pradhan Mantri Yojana that is there for nearly 60 crore people of our country for inpatient care, and the 1.8 lakh health and wellness centers, the Ayushman Arogya Mandirs, to focus on preventive and primary care. I think you asked the question, where did she not focus on? I think maybe she didn't talk about this. It may be there in the fine print.
Right.
But this is something she focused on last year and the year before that. So, healthcare delivery to the last mile is a slow process, because not only do you require infrastructure, you require financing, you require trained manpower, you require technology. And with her focus, she did talk about artificial intelligence. We have spoken about telemedicine. Bringing all of that together may take a few years, but I think we are on the path to achieving universal healthcare in the years to come.
Right. Do you think there was enough emphasis on, taking much of our medical expertise, which is still concentrated around the urban areas? I mean, you look at the names or you look at everything else, our main big hospitals, they are, overflowing with capacity. In terms of, or, you take your own diagnostic center, what will it take for hospitals and diagnostic centers like yours to move from, say, a Delhi to, say, a Kohima? Does the budget do enough for you guys to expand?
See, it's not only money that's going to do it. You need skilled manpower.
Right.
You need
So
trained doctors, specialists.
she did talk about the skilling.
She talked about skilling, but it's not an overnight thing.
Right.
It takes time. And what the government can do, and in some states is doing, is provide infrastructure. Like there is this push to turn the district hospitals into PPP hubs where we can create medical colleges. So, one, they will probably run more efficiently. Two, the private player will not have to buy land and build infrastructure. There is efficiency, more efficiency of operations in the private sector. Along with that, if you bring in teaching training of MBBS students, specialists, then this is our path to becoming self-sufficient and to be able to provide quality. The emphasis is on the word quality healthcare to the last man standing in the rural areas. But it will take time. And so we will have to choose a path which can do it as quickly as possible. But our focus should not only be on quantity, it equally needs to be on quality. And the government is focused on that. The private sector is willing to stand shoulder to shoulder with the government. As you saw during COVID, we worked so well together. I think if that trust deficit can be overcome, and if we work in unison, and the private sector is shown that there is a path to viability and maybe some profitability, I think we can achieve the goals in the years to come.
With the FM did talk about it, and you mentioned it as well. There are long-term health risks like obesity, which are non-communicable diseases.
Yes.
This is on the rise in India. Is there beyond what she mentioned? Do you think is there enough in the budget which emphasis on protection, well-being, and say early intervention?
See, that's where the health and wellness clinics, the Ayushman Arogya Mandirs, are envisaged to be that factor of preventive and primary care. If we are able to pick up disease early, if we pick up cancer in stage 1, stage 2, we can achieve a cure. Unfortunately, in our country, 70-80% of cancers are picked up in stage 3, stage 4, where it's a struggle. So hopefully, with screening schemes that are there, we will be able to pick up this disease early. Same with diabetes, hypertension, heart disease. The Ayushman Arogya Mandirs hope to achieve this. And then if we already have infrastructure which is built in, which our forefathers actually built, right from the primary health center to the community health center to the district hospital, then the medical college. You very rightly said, actually 70% of our population lives in rural areas and 70% of our healthcare is in urban areas, in cities. It will take, already, if you ask me, quality healthcare has reached tier 2 and to some extent tier 3 cities. The large chains, there is consolidation that's happening in the healthcare sector, but predominantly it's private healthcare sector that is doing it. I think public-private partnership, if the government can ensure viability for the private sector, then I'm sure there would be many who would be willing to take this to tier 4, tier 5 also. One constraint here is also that the specialists and the super specialists and the well-trained nurses and the well-trained technicians want to live in cities. They don't want to go to small towns. And that's where, if we are able to create these medical colleges, training centers and district hospitals and see that boys and girls from that district are the ones who are trained there, then they would be much more receptive to living in their homes, to living in their towns and taking up jobs there. But it's not going to happen overnight. It's a gradual process.
Right. Which brings me to the last question then. Looking ahead, what one priority area should policymakers and the industry, when I say industry, the healthcare industry, should urgently look at in the next, say, 12 to 18 months to strengthen India's healthcare system?
I think it has to be preventive and primary care. Because even for minor ailments, from the periphery, people rush to the large hospitals, be it government, be it private, in the towns and cities, whereas they may not need to do that. So if we are able to actually strengthen preventive care and primary care, then even this rush that you see in all hospitals, secondary, tertiary, quaternary, that probably would go down, definitely would go down in secondary hospitals. And also we need to strengthen these small hospitals which are already working in tier 3, tier 4, somehow strengthen them that they don't go under. So ultimately, I would think if we can focus on primary and preventive care and on delivering quality, that would be very useful. Through telemedicine, we can provide actually quality healthcare to anywhere, because the cell phone is ubiquitous. Everyone carries it, be it in the village or in the city. And telemedicine is one way. The finance minister talked about artificial intelligence. In the underserved parts of the country, artificial intelligence algorithms may be the surrogate doctor. And once they raise an alarm, then maybe a human doctor can take a look at that. So we will have to leverage technology along with creating sufficient skilled manpower to take care of our needs.
Great. I think strengthen primary and preventive care. I think that's the message here. Thank you so much for speaking to us. It was a real pleasure.
Thank you very much.